Good evening, everybody. This is Nurse Eunice with Saskia, and in tonight's video, we're going to be reviewing 100 common U.S. medical terms and translating them into Haitian Creole. And as we do with every video, we're going to give you a few seconds in order to receive your notifications. But I'd like to introduce our wonderful Saskia. Saskia, thank you so much for joining us. Would you please introduce yourself to our audience?
Hello, everyone. My name is Saskia Michelle, and as Miss Nurse Ernie said, we're gonna speak in Creole today. So let me say a few words in Creole. Non, moi rele Saskia Michelle, et moi content jodi an pou m'kapab ave nou, pou nou ka pale de 100 mots ki komen nan medical history.
All right, so that is wonderful. All right, so it looks like we have our audience here, and I do want to remind you that for the first part of this video, we will not be monitoring the chat. But once we are done with our 100 terms, that is when, if you have any questions for myself or Saskia, you're going to be more than welcome to ask those questions at that time. So here is our disclaimer that I do want to read, because we get a lot of students in our office who want to become healthcare workers, who are interested in the healthcare field. However, their English isn't the best. And so we need for you to be able to speak conversational English. You have to speak to the nurse whenever you're taking your exam, number one. But number two, when you're actually providing care, you have to be able to speak to 911, talk to the nurse who's responsible for that patient. So being able to speak English is really important if you're going to be a healthcare provider in the United States. So here's our disclaimer in English. This video is designed to help bridge the language gap for Haitian Creole speaking caregivers by translating common U.S. medical terms. However, we encourage those who face a language barrier to continuously improve their understanding of the English language, as this is essential for effective communication in healthcare settings and overall professional growth. And now Saskia will say the same thing in her native language.
Ok, nan video sa, disclaimer ke nou genyen, li di ke la ede nou kompran gap ki genyen entre lang kreol la e lang angle a. Kom etan yon caregiver, ou dwe kapap transmet e kompran medical term yo. Cependant, nou ankouraje chak moun ki gen problem pou yo apren lang nan, pou yo toujou kontinue pou yo kompran lang nan, pou yo kapap fè effort pou yo kapap komunike nan domen medikal la e osi nan domen profesyonel avansman yo.
All right, perfect. All right, so here is some additional information that we have for resources. We always want to give you a way to learn more. And so this is a free way for you to improve your English language. Did you know that the public libraries actually have free English as a second language or ESL courses? And that is nationally. So if you are in the United States, you can go to the public library or contact the Catholic Charities. Another option for you is usalearns.org. So if you don't want to go in and take a course that is, in person, you can also take a course online for free at USA Learns. And so we encourage you to take advantage of these resources to improve your language skills and enhance your career opportunities. Saskia, is there anything you want to add?
Ok, m kapap di ke nan chak library publik de pou ap viv nan Etats-Unis, yo bon mwayen pou yo ofri lang angle pou kapap apren, yo bay kousa. Et aussi, sous contacte Catholic Charities, yo kapap aussi offre kousa yo gratis, ou pa paye pour rien. Mais sous son moun ki pa gen temps pour aller directement nan lokal sa, ou kapap aussi aller sur un site qui rele USA Learns, et ou mette la www.usalearns.org, li encourage ou kapap aussi apprendre anglais a gratis.
Right, thank you. Let us begin our review. Abdomen.
Abdomen, ventre.
Allergy.
Allergy, allergie.
Anemia.
Anemia, anémie.
Antibiotic.
Antibiotic, antibiotique.
Arthritis.
Arthrite ou bien douleur dans zo.
Blood pressure.
Tension.
Bone.
Zo.
Brain.
Cerveau.
Cancer.
Cancer.
cardiovascular,
cardiovasculaire,
cataract,
cataracte,
chronic,
chronique,
colonoscopy,
colonoscopie,
constipation,
constipation,
cough,
tousse,
dehydration,
déshydratation,
diabetes,
diabète ou bien gen moun ki di maladie sik,
diarrhea,
diarrhée,
dizziness,
tête virée,
doctor,
docteur,
emergency,
urgence,
fever,
la fièvre,
flu,
grippe,
fracture,
fracture,
heart attack,
crise cardiaque,
heart disease,
maladie cœur,
hospital,
l'hôpital,
hypertension,
hypertension,
immune system,
système immunitaire,
infection,
infection,
inflammation,
inflammation,
insulin,
insuline,
kidney,
rein,
liver,
foie,
lung,
poumon,
migraine,
mal tête,
muscle,
muscle,
nausea,
cœur plein,
nerve,
nerf,
obesity,
obésité,
operation,
opération,
oxygen,
oxygène,
pain,
douleur,
pneumonia,
pneumonie,
pregnancy,
grossesse,
prescription,
prescription,
radiation,
radiation,
respiratory,
respiratoire,
seizure,
convulsion ou bien crise,
sore throat,
gorge fait mal,
stomach,
estomac,
stroke,
congestion cérébrale,
surgery,
opération,
swelling,
enflé,
symptom,
symptômes,
tablet,
graine,
tendon,
tendon,
test,
test,
therapy,
thérapie,
thyroid,
thyroïde,
treatment,
traitement,
tumor,
tumeur,
ulcer,
ulcère,
urinary tract infection or UTI,
infection dans appareil urinaire, dans appareil où fait pipi,
vaccination,
vaccin,
virus,
virus,
vomiting,
vomissement,
weight loss,
perte poids,
wound,
blessé,
x-ray,
radiographie,
anxiety,
anxiété,
blood clot,
boule dans sang,
blood sugar,
sucre dans sang,
bone density,
densité zo,
breast cancer,
cancer dans tété,
bronchitis,
bronchite,
cyst,
kyste,
depression,
dépression,
dialysis,
dialyse,
endoscopy,
endoscopie,
epilepsy,
épilepsie. Comme ça tout, gen moun ki kon di maladie malkadi,
fatigue,
fatigue,
gastroenterology,
gastroentérologie,
genetics,
génétique,
glucose,
glucose,
hematology,
hématologie ou bien étude toute maladie qui a rapport avec ça.
hepatitis,
Hépatite,
hernia,
hernie,
HIV,
VIH,
hyperglycemia,
hyperglycémie ou bien toxique qui renaissance.
hypoglycemia,
Hypoglycémie ou bien toxique qui bat ensemble.
influenza,
Grippe,
mammogram,
mammogramme,
MRI or magnetic resonance imaging,
sonorité magnétique,
numbness,
insensibilité ou bien l'on pas aucune sensation dans membre.
palpitations,
Palpitation,
physical therapy,
thérapie physique,
pulmonary system,
système poumon,
triage.
triage.
And guess what, everybody? We want to thank you for watching. And how do I say that in Haitian Creole?
Merci parce que vous avez regardé nous, parce que vous avez nous.
All right, so everybody, we're going to go to the chats now, and I do apologize for the beeping. I'm just going to go off camera for a few moments to take care of that sound. But for the viewers, we want to know what your needs are, because our goal is to help those, even if you are from another country and you have a limited English, you don't speak English as well as others. We want to encourage you to take the next step. And so, Saskia, while I'm addressing that sound, would you go ahead and open up the comments in the chat and see how you can help the viewers?
OK. Bon, je vais parler créole dans le moment ça. Il y a un pile monde qui dit bonsoir, nous dit hello, how are you? Bonsoir nous tous qui là. Nous avons un pile monde qui a écouté nous du côté Canada, du côté bon, OK. Et puis non, c'est pas Jamaican Creole, c'est Haitian Creole que nous avons parlé. Le créole que nous parlons Haïti. Okay. We want to say hello to everybody. And then some of you are listening from Canada and from Florida, the state of Florida. And we're going to speak Haitian Creole. I know there's different type of Creole, but this one is Haitian Creole. Yeah. Most of the people, they are okay. Yes, Montvalier. Glucose, you can say sucre. You can glucose. Sometimes it depends how you pronounce it. Sometimes it's the meaning of the conversation that you're having to that person. So you can say sucre, or you can say maladie diabete. It depends how you what is the conversation you're having with the patient, just for their understanding.
Okay. And looks like Mila wants to know, how do you say tachycardia?
I know. But c'est moi ça comme chercher pour nous tachycardia.
And then Adam, hey Adam. Adam wants to know, how do you say what is your name and my name is?
Oh, comment ou relé? Donc, Adam, if someone is asking you what's your name, you just say comment ou relé. And when you answer, my name is, let's say my name is Adam or my name is Saskia. Non, pas c'est Saskia, moi relé Saskia.
All right. And so for our viewers, are there any other questions that you have for Saskia? We are also actively looking for someone to translate our videos into Spanish. So if you know of anybody who may be interested in helping teach others. I've been telling God that I have a global business, but if I have a global business, why is it that my videos, my books, everything's only in English? So I'm going to be held accountable for if I say I have a global business, I need to prove it. So if there are, others who speak Spanish or a different language and they would like to join our team, we would love to have them, just like we have Saskia. We introduced Phyllis yesterday. And so we want to have a multicultural and a diverse team to help our audience. And right now we have viewers from all around the world, and we really do appreciate you all. And so Mad Ginny has said something that I can't understand. Oh, it's just tachycardia.
Yes. Okay. Oh, you just say that it's the palpitation now. But Makeugo, it's like you having heart palpitation.
And Mila has a question.
Have you ever had a patient that I spoke for in English? So does that mean someone that speak other language? Because what I do know, there's and I think Nurse Eunice can correct me if I'm wrong. When you go to the hospital or certain public administration, let's talk. When we go to the hospital and you don't speak the English properly, you can ask for translation. Whether you're from Haiti or Philippines or any other country, they do have a translation service where they're gonna, have someone talking to your language for you.
That is absolutely correct. So what we usually start off with is a communication board because there's so many different dialects. So just because you speak Spanish, as Saskia just said, there's different types of Creole. So she's translated in Haitian Creole. So we start off with a translation board. And what a translation board does is it is a sheet of paper that has a picture of a toilet. It has the happy faces, the frowning faces, all the way to somebody who's crying. And we allow the person to point to what they need up until the time where we can get a translator. We have to be careful. And a lot of times our staff is also diverse. So if we don't have somebody who is an employee who speaks their language, we will then contact a contracted translation service, especially if the person's going to be having surgery. The reason why is because if I'm having a family member translate something, I don't know what the family member is saying, what they are adding to, or what they are subtracting from that. And so it's really important. And so most of your hospitals have some type of translation service that abides by HIPAA confidentiality laws, and that's what they'll use to translate if the other options, such as the communication board and also having another staff member translate if that doesn't work. So very good question. My connection is awful. I may be in and out. Adam, we appreciate you for being here. And then Anne says she is waiting for her test date. So Anne, I am so proud of you. Congratulations in advance. And then Anne, would you read her last comment there, Saskia?
For Anne, I always listening to your videos. Oh, I wish it could be in Creole, on tap comprendre plus bien. Which part? OK. Qui parti ou ta reme comprendre en créole? Dernier conversation que Nurse Eunice gagne ou bien toute vidéo yo net? Parce que nous, un projet, c'est pour nous capable porter vidéo yo en créole kounya.
All right. So Anne, are you able to respond? And then Saskia, if someone wanted to follow you on social media, how could they contact you? Would you tell them and put it in the chat?
Okay, I have my Facebook. Okay, si on moun veut follow moi dans social media, moi gen Facebook moi qui c'est Saskia Michel, Saskia PL Michel. Instagram moi c'est aussi même nom, Saskia PL Michel, capable toujours taper li.
Okay. And so you all, we're going to be signing out soon. We appreciate you all for watching. And yes, Saskia PL Michelle. And on top of that, I think our next one is going to be interview techniques. But if you have a video request, please let us know so that we can have it. So we're going to have.
I'm sorry, Miss Eunice. I think Anne has a video request.
Okay, what is it?
The video to prepare for the exam, the CNA exam.
What state are you in? Because
Naki state koye.
The way that you prepare is based upon the candidate bulletin, and every state has a different candidate bulletin.
Oh, she said about the prometic test for CNA.
Well, Prometric does tests for multiple states. So you're in Florida. So let me go ahead while Saskia is on
She's
the
in
line.
Florida. She's in Florida.
I'm going to, when you say prepare for the test, are you actually talking about the test site, the clinical, or the written? Because we have playlists that covers all of them. And if you say all of them, I'll just add 3 different links in the chat. And I'm just going to hide myself from the screen for a few moments.
Okay. Donc, ça va dépendre de qui test qu'on veut. Est-ce qu'on veut test qui est écrit ou bien test pratique, là, clinique là, qu'on fait? Parce que c'est ça qui va dépendre qui ça que vous voulez dans le test là. Aussi, il va mettre 3 links pour dans le chat là pour capable aider ou dans la pratique. The reading one, texte écrit.
Okay. So I'm going to add a playlist for her right now.
Nous allons mettre link pour capable utiliser, capable faire practice avec.
Okay. And while I'm pulling up this playlist, let's see if she can still hear me. While I'm pulling up this playlist, and Flore, do know that when you take your test, you have to speak in English. So I haven't translated my written exam questions to another language just yet. But Saskia is going to review the videos, and then she is going to help translate some of the videos. So do you think that will help you with your written test?
Nurse Eunice dit que normalement tout test li aussi en anglais, mais nous avons travaillé pour nous capable traduire en créole. Donc dans le moment ça, est-ce que vous pensez que ça va aider qui devant? Mais normalement, même si nous traduisons en créole, en réalité, nous devons parler anglais parce que tout examen, c'est en anglais que vous faites. Yes.
Well, you all know how much that we appreciate you. Adam, and so many of you all who are on here. If there is anything that we can do for you, please let us know. And without further ado, I want to give you all time to click on that playlist. And don't forget, if you can't get to the playlist, if you just go to our YouTube channel, youtube.com/Florida spelled out training, click on playlist. If you're on your phone, it's going to look like there's only 4 lists or 4 video playlists. I promise if you scroll down, you're going to see everything that I've created for you, including for the nurses and the doctors. We have the ACLS videos. We have the clinical skills videos. We even have what to do when you're at the test site. We have the orientation videos, because our job is to make sure that you all succeed. So we have healthcare professionals for the future, regardless of what country you come from. So Saskia, would you please give us the closing words? Words of encouragement.
OK, words of encouragement, c'est malgré nous connaissons que nous plus confortable dans parler créole, mais pas oublier tout que nous vivons aux États-Unis. Donc pour nous capable progresser, nous devons mettre tout à tout, toute capacité nous en valeur. Donc nous encourager nous aller sur vidéo floridatraining.com pour que nous capable joindre toutes ressources importantes pour que nous capable progresser et réussir dans la vie par nous. Merci encore parce que t'écoutez nous.
All right, everybody. Bye. Have a good night. We'll see you in the next video.
Bye.
So good night.